Yes.
Okay, great. Good morning. I'm Bobby Lawrence. I met everybody on our previous webinar talking about MAP INA services. I'm here with Christy Mattingly, who is our program manager for the home and community-based programs. So we're going to kind of give you an overview of these Medicaid home and community-based programs here this morning. So I'll let Christy go ahead and start.
So good morning. So my name's Christy, and I am the program manager for the home and community-based services. And we have 4 programs, and all 4 of these programs are for individuals that have a nursing facility level of care, but want to receive services in the community as opposed to a nursing facility. The majority of our clients are in the Community Options Waiver Program or the Community First Choice Program. The Community Options Waiver is for all adults that are 18 and over. There used to be a living at home waiver and an older adult waiver, and in 2014, the waivers merged and now they serve all adults. So the first program I was going to talk about this morning is the Community Options Waiver. This program helps prevent institutionalization and helps people to receive services in their own home. So all individuals have to financially qualify, and also they have to have a nursing facility level of care to be eligible to be enrolled into the Community Options Waiver. The individuals in the program need to have an annual AIRS evaluation, which we'll talk more about later, and qualify for annually. So the support planners work with the participants and develop a person-centered plan that we submit to Maryland Department of Health for approval. And these plans that we submit are designed to provide the supports that people need to stay in their home. So the options that come along with the Community Options Waiver include both an assisted living option or services to support them within their own home or apartment. Yeah. Yep. Okay. So there's 2 ways to be enrolled into the Community Options Waiver. The first way is the registry, and the way that you get on the registry is to have a level 1 screen completed, and it gives you a priority ranking score, and then based on your risk for institutionalization is when you'll be invited to apply. They redid the way that they invite people. So 80% of the people that are on the registry are invited based off of their risk for institutionalization. And the other 20% of individuals that are invited from this registry are based on the amount of time that they've been on that registry. The other way to get enrolled into the Community Options Waiver is if they are if an individual is in a long-term care facility with long-term care medical assistance, then they also have the opportunity to apply for the Community Options Waiver. So anybody can refer somebody that is in a nursing home for options counseling. It could be family members or social workers or anyone that knows that the person is interested in returning to the community and is interested in having services. So the Bureau of Aging and Disabilities provides options counseling services for all individuals that are 18 and older.
Okay, this is Bobby again. I'm going to be talking about nursing facility program education, or the acronym, which there are so many of them, NFPE. And like Christy said, one of the ways that people can get referred to the Community Options Waiver Program is through referral of someone who's in a long-term care facility. So what happens is if someone is in a long-term care facility, they're often identified as those who may be able to transition out of the facility safely and possibly live in a least restrictive environment, but may still need services and supports. Often the individuals must have been residing in the skilled nursing facility for at least 90 days and have long-term care medical assistance or in the process of applying. So again, what we do is we can advise individuals of programs and services available to assist individuals with returning to the community. Some of the services were somewhat touched upon when Christy discussed the prior community options waiver when it came to maybe an assisted living facility rather than a skilled nursing facility. Maybe people need to look in the community and get support such as personal care, home delivered meals, so things they may still need to get in order to remain healthy and safe in his or her own home. So then what we do is we go out, or at this point talk on the phone regarding these services, possibly what options could be available. And then we follow up closely with whoever that social worker or advocate is at those facilities, regarding these particular needs of the individual. Assist with the long-term care medical assistance application if needed. Assist with obtaining supporting financial documentation at time, which can be daunting, and then help submit with that application. If someone has had long-term care already within the last 6 months, we just simply help them complete an intent to apply for waiver services form and then go from there. The next step would be then to provide what we call a supports planning agency packet to give someone the options to choose who they wish to help them through this process, if it be the AAA here in our office or another agency. And then we make the referral to the health department to complete the inter-eye assessment, to determine whether or not they have the appropriate level of care, and then to look at recommended services they may look at on a whole. Did I miss anything, Christine?
No.
Okay. So another program we're going to mention along with the community options waiver, and I think you can see some of this information on the fact sheets, is what's called ICS. So we like to mention it because it's a program similar to the waiver, basically the same, but it provides individuals in a skilled nursing facility who are over income for the waiver an opportunity to transition to the community with services. So if someone is denied for the waiver because of being over income, the program allows a way for those to be enrolled. Again, if you look at the fact sheet, it provides all the same services. Again, we talk about these Medicaid programs being ones that one needs to be financially and medically eligible. So this is just an added fact, just so you know, if you have someone, or maybe you yourself have applied for the waiver in the past and there's some issues with the income, this could be a consideration. And then again, the fact sheet gives you a little more detailed information specifically about those income stipulations. And then next, we can talk a little bit about Community First Choice, which we like to label the CFC program. So as Christy mentioned, I think initially the two most popular programs, or I shouldn't say popular, but most participants participate in either the waiver or the CFC. So this was developed in 2014 as part of the Medicaid expansion of community-based services. And for this program, applicants must have full community medical assistance. And what's nice about this program, in a sense, is there's really no application to complete. So possibly if you know someone who lives in the community, has medical assistance, and may need some assistance in the home. And we're going to talk a little bit more about what we deem the ADLs, the IADLs. So again, like the referral can come from anyone that you know in the community. They would, again, we talked about the level 1 screen they would receive and then be referred to the AIRS evaluation. Again, for this program, the eligibility is that they must have that nursing facility level of care or a special program code to be eligible. Again, you have the financial and the medical. And for this program, it's nice because there's no age limitation. There's also children in the program. And then the one limitation is that it does not include assisted living facility. So again, the flyer gives you a little more information, really mimics the CO waiver and exception for that assisted living, and also that we can work for young individuals in this program. Okay. And then we have the CPAS, which is Community Personal Assistance Program. So again, you can refer to that flyer. So this program assists services, or excuse me, the personal assistance services can provide services for clients who do not have that nursing facility level of care, but still need assistance with their activities of daily living and their instrumental activities of daily living. You know, so they have what they call a CPAS level. Again, referrals can be made from anyone in the community, refer for the AIRS level 1 screen, and then the NRI assessment. Now, CPAS only provides personal care, case management, and nurse monitoring, but they may be the needed services someone in the community you think may need. It would exclude then those services such as home delivered meals or a personal emergency response system. But it also is also a very valuable program, which is also indeed a Medicaid program as well.
So we have referred to the AIRS assessment a few times, and we wanted to explain what that is. It's Adult Evaluation and Review Services is what AIRS, what the AIRS stands for. And AIRS receives referrals for clients that are in need of services, and they conduct what's called an NRI assessment. And it's that assessment that generates either the nursing facility level of care or the CPAS level of care. And in addition to the NRI assessment that they complete, they also generate a plan of care. And on that plan of care, it lists all of the services that the nurse or the social worker recommends to support the individual in the community. So after we get the AIRS assessment, we're able to utilize that assessment to work with individuals to develop a person-centered plan. So as a support planner, what we do is we monitor the LTSS Maryland system to make sure that people are eligible. We can monitor the personal care staffing hours. We can see when there's a caregiver clocked in. And we can use the LTSS Maryland system for all of our documentation. So what we do is we try to make contact with our clients. In general, we try to have contact with them at least once a month. And we try to have an in-person visit with them every 90 days. Because of COVID, we have done most of our monitoring virtually this year, but in general, we would try to see people every 90 days. Something else that support planners do is to assist individuals with applying for different programs. It could be housing programs, it could be energy assistance, it could be any documentation or supports or resources that the individual is in need of. The support planner can assist with that. And support planners assist in creating that person-centered plan that we were talking about. So it can include all of the services, and we'll show you in a future slide what services are available. And we would set up all the services. We work with them setting goals, identifying individual strengths, and put all that together to make one comprehensive plan. So the plan of service, which is what we were just talking about, which is the plan to support the individuals while they're in the community. We work on that annually and then as needed throughout the year. So if somebody has a change and needs additional supports, or has a change and needs environmental assessment and adaptations or anything to support the person throughout the year, then we would revise it as needed. When we create the plan of service, we have to submit it to the state. We have to submit it to Maryland Department of Health and wait for approval before services can begin.
Okay, so the next slide or two, we're going to talk just briefly about what we term the ADLs and IADLs. So the plans of service we're discussing should be developed in association with the need for support with someone's activities of daily living or their instrumental activities of daily living. And most people are familiar with the term, but sometimes not often if we say ADL or IADL. But these are the series of basic activities necessary for independent living in the home or community. So that's what we want to make sure that these programs are addressing and assisting people to maintain. So again, the ADLs, you can see that they're listed, most of which you probably understand. Someone's ability to walk, to ambulate, to be able feeding, to be able to eat, dressing oneself, grooming oneself, toileting, bathing, and transferring, being able to move from one body position to another, or being able to move from a bed to a chair into a wheelchair. So these are all these types of things that often we just kind of presume that we can do, or maybe someone can or cannot do, but often individuals in the community, these programs are really addressing people to be successful and able to complete these activities of daily living, and they're very instrumental. The next slide goes over what we're deemed as the IADLs, instrumental activities of daily living. So they're similar to the ADLs again, but require more complex thinking and organizational skills. So often a lot of these programs in the community, you may have someone providing meal preparation, planning meals, cooking, cleaning, after a meal, nutrition planning, assisting with basic communication skills, assisting someone with making appointments, using the telephone, maybe with transportation, basically to get to needed appointments, shopping, assisting someone to get to the food store, clothing shopping, getting medications. Again, I mentioned performing light chores and maybe managing a personal finances. So these can be as helpful to those who are living in the community and need these types of assistance. And then Christy mentioned this particular slide, which is kind of nice because it looks at the three main areas, three main programs. It doesn't look at ICS, but again, those services will be the same as the community option waiver, the CO. The CO is Community Options Waiver, the CFC, Community First Choice, and CPAS, Community Personal Assistance Services. So you kind of see right there, this is kind of a nice summary that CPAS, if you're eligible for that program in the community, you're able to get some type of personal assistance. With the CFC, a little bit more, and then with the waiver ICS, it includes assisted living as part of that program. So I don't think I missed anything, Christy. And so again, if you have questions at any time, you can contact the Bureau of Aging and Disabilities. We have Christy Mattingly listed as our program coordinator. I'm Bobby Lawrence. I can also be contacted at any time regarding any questions. So that concludes our presentation.
Okay, so thank you so much, Bobby and Christy. Our next presentation begins at 10:15, so we will be back in just a few moments. Thank you.